Warm welcome to everyone here. I'm Dr. Anirudh Anilkumar, and today we'll be covering cancer awareness, prevention, and screening. So let's not waste too much time. Just a quick heads up. You might have questions pertaining to everything that we cover today. Just add them in the chat as and when you come up with them, and we'll discuss them all at the end because there's a question answer session you marked at the end. All right. So yeah, let's get started. So the funny title we went for was Cancer I Barely Even Know Her, because strangely enough, the only part of cancer that everyone is aware of is that it is a disease and that it's really dangerous. But exactly how to go about analyzing risks for it and how to even diagnose or screen it from an average person's perspective is something that's missing, not something you learn in school. So we'll be covering the difference between benign and malignant tumors, right? Every tumor is not necessarily cancer, basically. We'll be looking at risk factors, the ones that you can change, and the ones that make sure that you have to do more active screening. We'll be looking at the commonest cancers in India and the world, because that's how you screen, right? You look at what is commonest and you screen for them. And the most important thing, how to screen. So screening based on your gender, your age, and your risks. Finally, we'll discuss everything that's covered and have a little question answer session. Just a quick note about why it matters, why it's important to know about cancer. It's not really this perception that we have of a vague disease a friend of yours says their grandparent passed away from. The age with which people are being diagnosed has come down rapidly. In fact, 1 in 9 Indians today are projected to develop breast cancer in their lifetime. This is just one form of cancer, right? Lungs, prostate, stomach, blood, any organ you have can technically develop cancer. And why has this number gone up? It's because of an increased exposure to carcinogens and risk factors. So as I mentioned before, the age with which people are being diagnosed with cancer has come down. But there's also a bit of a silver lining. It's also that people are being diagnosed earlier, right? And that's a good thing because we can start treatment earlier and the outcome is usually better in that case. So yeah, the first thing, the difference between a benign and a malignant tumor. So you might notice people having swellings that are massive in size and surgeries being performed to remove kilogram heavy tumors. Those are usually benign, right? Because those cells are normal, they're just multiplying at a very rapid rate. They do not metastasize. That is a word that has sort of become the keyword in medical dramas across the world, right? Metastasis. So what is metastasis? It is a process by which tumors move to other parts of the body, either through your blood vessels or by invading local tissue. Only malignant tumors, actual cancers, can do that. How do you differentiate between benign and malignant tumors? It's done using a microscope, right? You have to do a pathological examination of the cancer, the growth, and then say whether it's benign or malignant. So why does it matter between benign and malignant? That you need to know that just because there's uncontrolled growth, it doesn't mean it's cancer. Depending on the type of cell, where it's growing, the type of cancer varies. This isn't meant to be scaremongering either, right? Being increasingly aware of things doesn't mean you become a sort of hypochondriac either. Your body does have multiple mechanisms to prevent cancer at a genetic level, at a tissue level, and as a system level. But when the redundancies fail, that's when an oncologist is involved because you now have cancer, right? That's why screening and risk reduction comes in. The number of oncologists in India is abysmally low, and we've just taken the title of the world's largest population, right? So you can't really head to an oncologist every time you have a growth or a lump. That's why you need to involve primary care physicians, right? The most important thing to know is that between 75 and 90% of things that look like cancer are not cancer, they're just benign tumors. The risk factors, you have modifiable ones, which include carcinogen exposure. Carcinogens are substances that can result in the formation of cancer. Diet, exercise, smoking, alcohol, lack of fun, stress, lack of sleep. Then you have the non-modifiable risk factors, the ones you can't really do anything about, such as your genetics, family history, race, ethnicity, and comorbidities, which are other diseases that are pre-existing. So yeah, a little bit more in detail, the lifestyle risks such as diet, poor diet is linked to cancer, lack of exercise is linked to cancer, obesity is linked to certain cancers. And of course, smoking. You'll be seeing smoking popping up across pretty much every cancer there is as a risk factor or even as a direct cause because of carcinogenesis. And that's just a fact. Same thing with alcohol. The sad truth is that there is no longer any permissible alcohol intake. Studies have shown that even one drink a day or two drinks a week does increase your risk of getting diseases. Then you come to occupational exposure. This is no longer as relevant as it was before because of things like OSHA coming up. Before, you had people with asbestos exposure getting mesotheliomas, radon gas exposure, smoke exposure. The thing is that people who were exposed in, say, the 70s or 80s are developing cancer now, right? So if you or a loved one, is of that age, then you need to be aware of it. Then the carcinogens I mentioned, smoking, nitrosamines. The fun fact, nitrosamines are actually found in smoked or salted things like salted fish, smoked fish. That's why it's good to avoid them. Then things like asbestos, which a lot of fireproof cladding was made from back in the 70s. DEC, which is a chemical that was used during the 70s to prevent miscarriages, but later on they found out that it leads to formation of vaginal cancer in the children of people who receive that medication. Radiation exposure can be because of your job, or even if you were undergoing radiotherapy for a previous cancer, it is possible for you to get a different cancer from that radiation exposure. And lastly, immunocompromised, people whose immune systems are weakened, either because of something like HIV/AIDS, pre-existing conditions, or if they've got immunosuppressants like steroids going on, because certain viruses infect you and they increase your chance of developing cancer. So this is just a quick guide of alcohol. Not all alcohol is equal, right? We'll share this resource with you later on so that you can go about it. But basically trying to tell you that, that one glass of beer is actually 3 units of alcohol. Right? And yeah, as I mentioned, smoking is something you'll see throughout. The surprising thing is the most common cause of mortality from smoking is not actually lung cancer. It is coronary artery disease, wherein your heart is affected and the vessels that supply the heart are damaged, because of which you get a heart attack and you pass away, right? And the important thing to know is that all smoking is not the same, right? Even reducing 1 cigarette a day reduces your risk of mortality. There is a threshold known as 20 pack years, which if you cross, your risk for lung cancer is almost 20 times, right? So try to quit before you reach that. That is basically smoking 365 days, as in 1 year. If you're smoking 20 cigarettes a day for 20 years, that is the cutoff. So please try to reduce or quit well before you reach that cutoff. Quitting is obviously easier with the help of a therapist or a GP or a psychiatrist. Now we come to the risk factors with respect to the different types of cancers. The first is, of course, breast cancer, which is pretty well known thanks to the Pink Ribbon Foundation. If you have a positive family history, that is the most important thing that can lead to you having to be more aware about breast cancer, right? Screening more effectively. But also note that just because someone from your family has breast cancer does not mean that you are automatically guaranteed to get breast cancer. It's a numbers thing, right? Your risk is more. That means that you have a genetic predisposition to developing breast cancer. And like I mentioned, previous radiation therapy. If you've received radiation therapy for any other reason, such as previous cancer tumors or certain bone marrow transplant procedures, the risk of getting breast cancer is more. But obviously, the most relevant one of those two words at the bottom, smoking and alcohol, both linked to increased risk of breast cancer. Cervical cancer, as I mentioned, the chemical known as DEC and DAS, they do result in it. It's more in Western countries. Thankfully, we're protected. HPV infection, perhaps the most important takeaway with respect to cervical cancer, is that the human papilloma virus, which is found in genital warts and also in normal tissue in the cervix, can result in the formation of cancer, right? Nowadays, even in India, you have HPV vaccines such as Gardasil available. Try to have you or your child take them at the earliest. So before 16 years of age, if you take it, you require only 2 doses. If you take it after that, you require 3 doses, right? And yeah, unvaccinated early initiation of sexual activity is a risk. Multiple unprotected partners. Obviously, the risk of transmitting a disease increases as exposure increases. And of course, again, if your immune system is not working, you have an increased risk of cancer. Family history, always there as well. Of course, again, the most important, smoking. And yes, we come to lung cancer, the poster child for why you should quit smoking. You need to look into the fact that smoke from anywhere can cause lung cancer, right? Additionally, diesel fumes, silica dust, which you see near glass factories, and even air pollution to some extent is linked to development of lung cancer. But take the air pollution thing with a pinch of salt. It doesn't mean just because you've been living in Delhi or Bangalore or Mumbai, you're going to get lung cancer. You're much more likely to get lung cancer if you smoke, half a pack a day for 10 years, right? Again, if you have family history, very important to screen for lung cancer. Oral cancer, uh, perhaps the only cases of oral cancer you'll see are from smokers or smokeless tobacco. This is things such as pan, tambaku, which is less common these days, more common in the older generation. These all lead to oral cancer. The thing is, if you smoke and drink alcohol, your chance of developing oral cancer is almost 10 times that of someone who just smokes or just has alcohol, because they have an additive effect, and essentially the risk of carcinogenesis is almost 10 times. Similarly, family history, and here poor diet plays a role, because if your mouth is the entrance to your GIT, so whatever you take in does matter. Infections and ulcers. If you constantly get ulcers and you smoke and you drink, it's possible it can transform into a malignant tumor. Gastric cancer, definitely on the rise in India, especially more relevant towards the southern states. The incidence is higher there. What you need to keep in mind is smoking, as usual, is important there. Alcohol is more closely linked to gastric cancer than the other cancers. Family history, very important. Dietary habits, of course, your GIT, your gastrointestinal canal, is the one that's affected the most by the food you eat. Infections and ulcers over here as well, which are relatively rare. How to screen? So we're going to screen only for the commonest cancers, because like I said, it's a numbers game. We cannot afford to screen for every cancer in your body, because the incidence of those is very rare. But breast cancer, lung cancer, oral cancer, cervical cancer, and gastric cancer, you need to screen, specifically breast and cervical. As you can see, the others are only for people who have the risk factors we discussed before. Breast cancer, now again, based on gender. It is important to keep in mind that males can also get breast cancer, but it's much rarer, right? Like almost 1 in 100 male compared to females. But when males do get breast cancer, it tends to be more aggressive and requires more treatment, right? But in women, if you're in the age group between 25 to 40, then you need to do a clinical breast examination every 2 or 3 years. What is a clinical breast examination? It just means you go to a doctor and have it examined by a clinician, right? You can go to your gynecologist, you can go to your GP. That's enough at that point. But the most important person who notices anything wrong with your breast is ultimately, of course, you. So you have to do self-examinations. You must check for lumps, nodules, discoloration, that is change in color, or discharge from the nipples. Any skin changes, like skin becoming a little bit more stretchy or a scar type tissue developing. And the best time to check your breast every month is a few days after your periods, right? We'll be sharing the resource for how to go about self-examination so that you can get a better idea. Now, women above 40 are at an increased risk. That is why you need to get a clinical breast examination, ideally every year by a trained physician. And you need to do a mammography as well. This is where, so if you're under 40, mammography is not very beneficial unless you have a high risk. But if you're above 40, a mammography once a year is recommended. It can be once in 2 years initially, and as you grow older, increase the frequency. The reason for that is that as you grow older, the density of your breast tissue decreases, which means that a mammography is more effective. When you're young, mammography's X-ray cannot really penetrate the breast tissue, right? So again, the best person to decide this is your personal physician, right? Discuss with them and they'll recommend to you based on your risk factors. Self-examination, still the mainstay, because testing for it once a year versus you testing every 2 weeks or every week, you're definitely much more likely to pick up anything that's wrong. Now we come to the special characteristic group, which is anyone who has got any of the risks that we mentioned, right? If you've got a family history, if you've got risk factors, then you need to have a clinical breast examination regardless of your age. Right from the age of 25, you need to go visit your gynec once a year to get yourself examined. And you need to start annual mammography. Ideally when you're around 30, 35 years, no need to do it when you're 25, because as I mentioned, the utility of a mammography examination is limited because the breast tissue's density is higher when you're young. Can start between 25 to 30 years as well. MRI is a new modality that has come up. However, obviously the cost of something such as an MRI just for routine screening is something you must consider. Self-examination, always the mainstay. Like I said, first person to notice something that's wrong is going to be you. You need to take advantage of that. So just a brief outline of the steps of breast examination. You need to make sure you're thorough, lift your arms and check under the breast as well. We'll be sharing the resource with you. Lung cancer. Lung cancer, more common in males than females because males are more likely traditionally to smoke. If you have more than a 20 or 30 pack year history, pack year is what I discussed. If you're smoking one pack of cigarettes a day for 20 years, that is considered to be one pack year. So if you have more than 20 pack years history, you need to get a low dose CT scan once a year, right? After you turn 55 years of age. Otherwise, you can ignore it. Again, the sort of equivalent to a self-risk examination here is you noticing if you develop any shortness of breath, chest pain, blood in your sputum or phlegm, anything unusual that develops and progresses rapidly related to breathing. And if you've got a history of smoking, consult your doctor at once. Let the doctor take the call whether you need to go ahead for a CT or not. Because as I discussed, radiation is one of the causes of cancer. So you can't just have a CT scan done to everyone who comes to you and says, I have chest pain, because then you're technically increasing the incidence of cancer itself. It's a bit of a catch-22 situation. Then cervical cancer screening. Pap smears, everyone has heard of them. Surprisingly, few people tend to do it though. So what is a pap smear? It's a procedure wherein during your gynec examination, your gynec will take a small, either a plastic spatula or a wooden spatula, take a small sample from inside your cervix, put it in a tube and have it analyzed later under a microscope. The earliest signs of cancer are changes in the lining of the cervix, right? And that's visible under a microscope quite easily. No need for any expensive equipment. The best way to prevent cervical cancer, as discussed, is the HPV vaccination. Like I said, ideally do it before 26 years. If done after that, you need to have 3 doses. If you can do it before 16 years of age also, it is quite beneficial because the protection is long and lasting. Again, we'll be sharing guidelines related to screening at the end of the presentation. Oral cancer. Thanks to the advertisements at movie theaters, people know all about Mukesh and oral cancer. But what you need to remember is that just because Mukesh has a highly developed tumor doesn't mean you will notice the same thing. The earliest signs that you see are reddish or whitish blacks in your tongue or on the side of your cheek. Those are known as pre-malignant lesions. What happens is these lesions develop into cancer later on. But if you notice them early and get a minor scraping done professionally, obviously by your surgeon, then you completely eliminate the risk of transformation into cancer, right? And knowing that situation is really bad is if you have something known as trismus. Trismus is difficulty in opening your mouth. Ideally, when you stretch your mouth open, as in open it fully wide, you should be able to admit 3 fingers into it vertically, right? In case you notice any of these issues, please go see a surgeon or a surgical oncologist. As I mentioned, surgical oncologists, very few available in India. Go to them only after your diagnosis for cancer. Until then, consult a general surgeon. Gastric cancer, as I said, the incidence is rising. Again, more common in males, much like all the other previous cancers except cervical and breast cancer. There is no specific screening protocol. It is usually diagnosed when you have issues pertaining to your gastrointestinal tract. If you have blood in your stools, you have sudden loss of appetite and you're losing weight without trying to lose it, abdominal pain, constipation, and a feeling like even when you go to the washroom, you've not passed stools, right? After passing all your stools, you feel like there's something left over. It's known as tenesmus. In case any of these are present, please go to your gastroenterologist or a GI surgeon. They'll rule out everything else, and then they'll do an endoscopy to diagnose your cancer, right? Because until you do an endoscopy, there's no real way to know where the cancer is located to take a sample. And it's an unpleasant procedure initially. So we don't do an endoscopy until unless everything else has been ruled out. Just a quick note about thyroid cancer screening. It's commoner in women. The only time you need to be concerned about it is if you notice a lump or swelling in your neck, right? In the side of your neck particularly. If you have that, go to your physician, let them rule out thyroid cancer. Thyroid cancer is quite easily curable, pretty good rates unless it is anaplastic thyroid cancer. Skin cancer, something which Indians are not very worried about because we usually have a lot of melanin. But if you do see something on your skin that fits into the ABCDE, then you should be worried. And by worried, I mean just visit your dermatologist, right? The ABCDE that I mentioned, A stands for asymmetry. If you see a mole or something resembling a mole that 2 halves are not equal, you need to go see a dermatologist. If the border, so if you see a normal mole has very round borders, right? If it's an uneven border, better to get a second opinion. Color. If the skin patch that you're seeing has uniform color, it's most probably fine. But if you see a variety of colors, there's light brown, there's black, then better to get it checked out. Same thing, size, right? If it's less than 1/4 of an inch, which is basically 5 millimeters. If it's more than 5 millimeters, need to get checked out. And evolution. The most important factor here is evolution, right? If 2 weeks back it was just a small black mole, and 2 weeks, I mean, currently it's become 1 centimeter big brownish mole with a little bit of discoloration, then definitely get it checked out, right? Because it's changing very rapidly, which is not something that is good. And of course, why should gals have all the fun? Males have got a type of cancer only they can get, which is prostate cancer. It's kind of like to make up for cervical cancer, I suppose. The screening for prostate cancer is using PSA, which is prostate specific antigen, and also a digital rectal examination, which will be done by your urologist usually. It's only recommended in people who have a high risk for it. And prostate cancer is usually seen only in males above the age of 40 to 50 years, right? So screening using PSA and digital rectal examination normally starts only above 50 years, right? It's something which is routinely done, and both the tests are pretty easy to do, relatively inexpensive. What to do in case your PSA is high? Because this scenario happens quite often because PSA has a lot of false positives. So if your PSA is less than 2.5, retest after 2 years. If it's more than 2.5, you need to test after 1 year. Right? And your urologist will discuss this with you, your surgeon will discuss this with you, just mentioning it so you don't go into it unprepared. Risk factors, the things that means you need to start screening from 40 years. Your age increasing, right? Prostate cancer is much more common as age increases. Smoking, family history, and a history of infections, especially sexually transmitted infections, and prostatitis, which is swelling of the prostate gland itself. Similar to breast examinations for females, we also need to make sure that males do testicular examination in the shower, because testicular cancer is also on the rise, not yet reached significant enough numbers. That is possibly due to it being underdiagnosed in India. So keep in mind, always the first person to notice a change in your body has to be you, and you can take advantage of that. A quick note about blood cancers. Blood cancer is usually seen in the pediatric population, right? In adults, you don't really see leukemias or lymphomas. But even if that is there, the only way to really diagnose it before it gets really bad is through your blood count, right? Which is normally part of all the annual health checkups that you do. This is why it's very important to have an annual medical examination. Because more than anything else, even if you had normal annual medical exams of 5 years, it really helps out when you go to your primary care physician with these records, because then anything out of the ordinary can be noticed immediately due to the history that you provided for the past 5 years, for example. And that's why even something like your red blood cell count momentarily spiking can alert your doctor that something is wrong. But as far as absolute symptoms go, if you're getting recurrent fever, night sweats, bone pains, again, unintentional weight loss, or recurrent infections, consult your doctor. They will rule out cancer using a simple blood test, right? Like I said, most commonly seen in pediatric cases. These symptoms are also seen in tuberculosis, right? That's why you need to go to the doctor so they can differentiate the two things. Now, how do you activate the process of going about how to get something looked at, right? As I mentioned, you're the first person to know something's wrong. So what do I do if I notice something unusual in my body? Like I said, not feasible to consult an oncologist or oncosurgeon, right? Because we have a few thousand of them catering to 1 billion plus of the population. First point of contact is usually going to be your GP or a family physician. They will guide you on the screening process, what tests to do next, and then they will also interpret those reports. And if it seems like it requires further care, they will refer you to a specialist, right? Like, for example, gastric cancers are dealt with not just by oncologists, GI surgeons deal with them as well, oncosurgeons deal with them as well. So your primary care physician will redirect you to the specialist with all the information the specialist needs to start the care for you, right? Something important, the reason you need to consult a doctor first before going to the specialist is because a false positive needs to be ruled out. And that has to be done at the level of the primary care physician before you head to a specialist. As I said, time is something that is not very available with respect to specialists in India. Now, what if the worst case scenario is true and you've been diagnosed with cancer? After diagnosis, your oncologist or oncosurgeon will decide the best treatment option for you. Again, it depends on where the cancer is, what the type of cells are, and how much it has spread. The three main modalities of treatment of cancer are chemotherapy, which everyone has heard about, thanks to popular medical drama showing people losing their hair. It is true, certain chemotherapy drugs do result in that. What they are highly effective medications that target only cancer cells. Essentially targets all cells that multiply quickly, right? Your hair follicles are one of them. So it's temporary. You do lose your hair, but it comes back once your chemotherapy is over. Then we come to radiotherapy, which is radiation used to destroy cancer cells, sort of double-edged sword here, as I mentioned, because if you don't use targeted radiation, and if the radiation exposure is too much, you can develop other forms of tumors. It's very rare, happens in less than 1% of people who undergo radiotherapy, but it's still something you must consider. Surgery, which is the most effective modality if you look at it, is the removal of the tumor as it is, completely en bloc. So the issue with surgery is that obviously it can have cosmetic implications, for example, something like a mastectomy for breast cancer. But in exchange for that, you do have cosmetic therapies these days to fix that. Surgery also carries its own risk. If it's not done properly, there is a risk of recurrence, relapse, that it's known as. But nowadays, the combinations of each of these things is what is done. So before surgery, you'll have chemotherapy, and then you'll have your surgery, so that the effectiveness of the treatment has essentially gone up. So nothing is missed during surgery. Don't worry, your oncologist or oncosurgeon will guide you about the process. What is important, though, is the importance of mental wellness. It's understood that it's a difficult diagnosis, right? A lot of times cancers can be terminal, even if they're not, as I just mentioned, the side effects of the treatments themselves are quite severe. So your loved ones, friends, and even therapists these days are required for you to cope with the diagnosis. And if you know someone else who has cancer, it's very important that you empathize with them, right? And it's best to avoid lying to them, because people do tend to lie to people with cancer in order to reassure them. It's better to give them realistic goals. And you need to understand that 5-year survival rates, which people talk about, or 10-year survival rates for cancer, these are statistical likelihoods, right? It's based on decades of clinical research. However, it does not mean that they're absolute. Someone who's given a 5-year survival rate of 90% can very well pass away in the next 2 years. Someone who's given a 5-year survival rate of 10% can very well live for 10 years. But you must understand the exception does not sort of prove the rule in this case. It's just coincidence. The same logic is often used by people. For example, if you tell them to quit smoking, then, oh, I know an 80-year-old man who's been smoking for 40 years doesn't have cancer. But for every single one of those 80-year-old men who've been smoking for 40 years, you have around 30-year-olds who've smoked maybe 5 years who've already been diagnosed with lung cancer. So we need to keep that in mind. Yeah, we've already spoken about what to do. The key takeaways that we've come across based on all the data we've had so far. Most important, all growths, lumps, swellings, tumors, not cancer. Even if it's diagnosed as a tumor, it is not cancer until it's been seen under a microscope and a pathologist says that it is malignant. It is a tumor, which is cancer, right? So avoid that stigma. Secondly, dietary factors. Avoid processed foods. Avoid smoked or salted foods, as I mentioned, nitrosamines for gastric cancer. And add exercise to your daily existence, basically. Because if you do 150 minutes of moderate intensity exercise every week, it does have a protective effect against multiple types of cancer, right? Family history does not mean you will definitely get cancer, very important. It means you have a higher risk, always a numbers game. You need to be more aware about screening yourself regularly, as I mentioned. For example, in breast cancer, you have to take screening earlier and more frequently, right? Nearly every cancer is linked to smoking, as I talked about, not just lung cancer. If you've been looking for a reason to quit, you've got it right here. If you or a loved one is being evaluated for being diagnosed with cancer, don't underestimate the role of mental wellness, right? You absolutely have to understand that mental wellness can carry a huge part of how people even respond to treatment, where they have the strength to carry forward with the treatment. Yeah, the quick screening recaps. Breast cancer, if you're female and over 40 years, you have to do it once a year. If you're under 40 years, self-examination is more important. You get a clinical examination done 2 or 3 years. If you're at high risk, MRI screening might be an option because, as I mentioned, mammography in a young age is not feasible. Cervical cancer, your HPV vaccinations ideally before you turn 26. Pap smear and HPV DNA, these are the tests that you do. Every 5 years is what is recommended, right? Obviously, the frequency for that becomes every 2 years after menopause, which is usually between 40 to 50 years. The lung, stomach, thyroid cancers, in case you are high risk, only then you really have to screen for them at a semi-regular basis. And mostly it's clinical screening. You just go to your doctor, have your annual medical examination. Skin cancer, the ABCDE we discussed, right? Asymmetry, border, color, diameter, and evolution. Prostate cancer, annual screening of once in every 2 years between the ages of 40 to 50, you need to start. Again, if you've got risk factors, you need to screen every year and you need to start screening earlier. If If you don't, you can afford to wait, no problems. Yeah, so these are the resources and references which we'll be sharing with you. The data is quite recent, which is important for everyone to realize. And these are the guidelines for screening which we'll be sharing as well. So yeah, we'll be having a short question answer session now. In case you've got specific symptoms or things like that, you need to use the Plum app to schedule an appointment with the doctor for dedicated care. However, if you've got any general questions, I think you've already put a few in chat. Please feel free to ask them. All right. So yeah, we'll just go through the chat and answer questions now. The very first one is HPV vaccination recommended for male, female, or both? Only females, right? Because the HPV is linked to cervical cancer. In males, it can cause genital warts, right? And also the transmission of HPV itself, right, is more towards females because of how sexual penetration occurs. Because the mucosal vaginal tears, the HPV virus is able to infect the cells in females easier. In males, it is relatively unheard of. So HPV vaccination for females, right? If you want to prevent warts, you can very well have it in males, no problem. What has been the increase in incidence of cancer and improvement recovery rates of various types of cancer over the last 20, 30 years? Yeah, obviously cancer therapies have become much more effective over time. Like I said, if you want to take just one aspect of it, let's take breast cancer. Breast cancer, because it's common. Initially, there was something known as a radical mastectomy, where the entire breast was removed, right? That was the only treatment that was there. This is not that far back. It was in the 20th century itself, not anything beyond that. It was quite barbaric, but it was practiced. Nowadays, you remove hardly 2 centimeters of tissue, depending on the size of tumor, and there's very good cosmetic surgery that helps you recover. Apart from that, you have things like neoadjuvant chemotherapy, where you combine the chemotherapeutic agents, which also have come up a long way in the past 20 years. You have cisplatin and methotrexate these days. You combine that with surgery, as I mentioned, to give really good results. Same thing for thyroid cancer as well. If you do surgery early on, 100% cure rates are quite common in thyroid cancer as well. Prostate cancer, you have robotic surgery being done for prostate cancer these years, right? So yeah, it's all become much better with time, and we continue to improve almost every year. Awareness and screening is, of course, a very important part of it as well. Okay, so the next question is, my father had oral cancer, which should I get done regularly? Okay, so this is a good question, very personal, but also very important. You need to understand that you have a higher risk for malignant transformation, which is formation of cancer. Just keep an eye out. Make sure you have good oral hygiene, first off. Because as I mentioned, infections and ulcers can result in cancer as well. Secondly, as I mentioned, the 3-finger test to see if your mouth opening is limited. Thirdly, get a dental examination done every year, right? Because if there's anything wrong, it's unfortunately your mouth is one part of your body wherein you don't have the best view. You depend on things like mirrors. You can't look directly in your mouth. So this is one place wherein a clinician looking, just a dentist, if you're going for scaling or cleaning your teeth, they'll pick up something abnormal as soon as they do, right? So yeah, just clinical examination by a dentist, good oral hygiene, and check your mouth opening regularly. The resources have been shared. Thank you. In general, we have a very strong impression that cancer is not purely curable with various available treatments, either suppress or prolong. Cancer is curable, but that doesn't mean that all cancer is curable. Like I said, it depends on when it is diagnosed. The surgical option, which is the most commonly curable option, is only possible if it's diagnosed early on. And that's why screening is so important, right? If you screen, you can diagnose the cancer much earlier than when it comes with really bad symptoms. When you notice that there's a massive growth on the side of your neck, which has spread from cancer in your lung, right? Before that, if you notice a shortness of breath and you know that you have a history of smoking, then obviously you'll be more likely to screen for it, right? So yeah, prolonging lifespan, the quality of life for cancer patients is something that is improving every day. Chemotherapy has taken its toll. Once a person knows he or she has cancer, half the battle is lost because of fear of losing life sooner or later. How does one fight that, and any suggestion? Like I said, great point. The mental health really comes in here, because once you're diagnosed with cancer, you need to have a motivation to keep you going in that sort of fight against cancer, right? And that comes in from your family, your friends, or even like-minded people. I believe one of the best-selling Shark Tank equivalent products in Australia was actually a product that linked cancer patients together. So they were able to provide support for each other, right? and they were able to tell each other about their struggles and give each other motivation to continue. So yeah, community is key here as well. What are symptoms for oral and lung cancer? Yeah, oral cancer, as I mentioned, anything abnormal in your mouth opening being compromised, whitish or pinkish lesions, plaques, which you can't really scrape off on your tongue or on your cheek, small ulcers that are not healing, black color discoloration, easy bleeding of certain parts of your body. Right? Lung cancer, anything related to the chest pain, difficulty breathing, constant requirement for sitting down when you're walking, right? Things like that. And also, if you're a smoker, then you need to be more aware. These are early symptoms, right? If you see these things, it's early on, you can still catch it, you can feel better. What are the causes of cancer apart from poor diet or low immunity? All the factors I mentioned, like genetics, which are non-modifiable, smoking, alcohol, which are modifiable, family history, which is non-modifiable, and depending on the type of cancer, like radiation exposure for certain types of cancers, exposure to carcinogens, which are seen in case of pollutants in others, right? Those are the causes of cancer. How do skin lesions start in leukemia? Leukemia, as I said, mostly seen in children. There are certain forms of leukemia, such as mycosis fungoides, wherein you basically have large patches of blotchy red skin that present. But otherwise, leukemia usually diagnosed when you do a blood count and the person has really low platelets. Really low platelets you'll see, or really high platelets sometimes. You'll see when they get purple spots all over their body or red dots all over their body. Like I said, usually seen in children. Does drinking alcohol increase chance of cancer? Absolutely. Multiple cancers have been linked to alcohol, including stomach, oral, and breast cancer. Right? Pancreatic cancer, liver cancer, also yes, but the incidence of those are relatively low. CBC test in blood, yeah, CBC will help you diagnose all the blood cancers. As I mentioned, leukemias and lymphomas can be diagnosed with CBC. They also help to diagnose things such as lung cancer sometimes because of certain markers that are increased. Right? Do the chance of cancer reduce if someone quits smoking and drinking? Yeah, absolutely, it does. As I mentioned, the moment you quit, your risk of cancer goes down significantly. How much is difficult to quantify depends on how long you've been smoking and when you quit. But will it ever be the same as someone who's not been smoking or drinking? No. Right? You've exposed your body to carcinogens. The probability of cancer is much more, but it is much lesser than if you were to continue doing that for the next, say, 10 years. Right? So anytime you quit is the best time to quit. As simple as that. If you've been smoking or drinking for the past 5 or 6 years, as I said, 20 pack is the cutoff. You are at 25% of that. If you quit now, it'll be much better than what it will be 15 years down the line. Right? That's what is important. Family history of cancer. How often should I get checked? Depends on the type of cancer. Usually once a year is the screening for most types of cancer. What tests? Again, depends on the type of cancer, as we discussed. Mouth opening. Is it between upper and lower teeth? No, it's just into your mouth, right? So I didn't want to do it because it was quite graphic, but essentially you take 3 fingers, I put it in your mouth. Right? If you're able to fit it in your mouth, it's good. You don't have a difficulty in mouth opening. Why in most cases the symptoms are not known until the last stage? Yeah, absolutely. It's not known to the last stage because of the lack of awareness and screening, right? Because unfortunately in India, screening campaigns not very prevalent, and even if they are there, they are restricted to urban cities. And it really doesn't matter if you live in a village or a city. Cancer is cancer; it doesn't discriminate, right? If your diet has, say, pickles and smoked food, people in villages also have the same food, right? People in villages, in fact, have a higher percentage of smokeless tobacco. You're much more likely to chew tobacco in a village compared to city. But the awareness for oral cancer there is minimal because you don't go to a multiplex theater and watch the Mukesh ads in a village, right? So unfortunately, the campaigns all target urban areas. Something is better than nothing, but because of this lack of awareness, things do get really advanced. I have one ulcer in my mouth from 5 years, not painful. I suggest booking a teleconsultation and speaking to a dermatologist or oral consultant. CBC tells you about risk of having cancer. Yeah, why do doctors check? Yeah, it does tell you risk of cancer. Like I said, the blood count, the RBC, WBC platelet. Why do doctors ask for regular CBC during chemotherapy? To see bone marrow function, right? As I mentioned, chemotherapy affects cells that divide very frequently. Your bone marrow is one of them. It constantly creates new red blood cells, white blood cells, and platelets. So chemotherapy has the potential to affect your bone marrow. To see if it is healthy or not, you have to routinely take CBC. And also some cancer agents affect your absorption of folic acid, which is required to make red blood cells. So the size of the red blood cell is also important to measure, the more folic acid is there or not. Okay, more questions. How dangerous is passive smoking? It's as dangerous as smoking technically, because your smoke exposure is significantly lower compared to someone who's not being exposed to that smoke, right? Obviously, the other carcinogens like the tar and things like that are not getting in your lungs, but smoke itself, as you know, is a carcinogen. What are the symptoms of glioblastoma? Glioblastoma is a nervous system tumor. It's relatively rare. Unfortunately, it's a very aggressive form of tumor, and the symptoms range from anything that affects brain function. You can present with loss of consciousness, very severe headache, loss of function. It can resemble a stroke, right? You're not able to move certain parts of your body, not able to speak. That's how, yeah, glioblastoma multiforme usually presents. Does high red blood cell distribution with tell you? No, not really. Red blood cell distribution with tells you about how frequently new cells are being produced. It can be because you have iron deficiency anemia as well, right? In high ESR, is indicator of cancer? No. ESR can be increased because of any reason leading to inflammation, including infections or injury or just lack of sleep and stress, right? ESR is a very non-specific marker. Why is there a steady increase in cancer patients in India? As I mentioned at the start, this is because of two main reasons, right? One is the increase in people being exposed to carcinogens and things that cause cancer. Two, our screening technology has become better, right? We have mammography available now to pretty much everyone who can afford it. And that means that we can pick up these things earlier. So if you're picking things up earlier, it looks like the frequency has increased, but not really. We're just diagnosing things that went undiagnosed for decades. How does sleep impact cancer? Poor sleep leads to accumulation of certain things, especially in the brain, right? Not just cancer, things such as neurodegenerative diseases also. Oxygen radicals, if you don't sleep enough, they accumulate, and that can result in damage to DNA, and that can technically result in cancer. Can skincare products lead to cancer development? As long as it's verified and been tested, it should be safe, right? The best thing to do is to use sunscreen. What people don't realize is you should use sunscreen technically every day, not just when it seems like it's summer, because UV rays are constantly present. What should you look out for any products that could be cancerous? Like I said, if it's coming from a reputed company that is known for testing, then it's all right. But there is a caveat in mind that that is not a guarantee. For example, Johnson & Johnson had to recall talcum powder across the world because it was linked to asbestos, which is, as you know, linked to every type of cancer, including skin cancer and mesothelioma, right? Do microwave oven and non-stick cookware have carcinogens? Microwave oven, yes, but it's usually shielded, so you don't get exposed to the radiation. But that type of radiation is microwave radiation. It causes burns, right? So unless you're getting burns, you should be fine. It's shielded, right? It's a Faraday cage. Non-stick cookware have carcinogen? Not really. Teflon, because it is fluorinated, has been linked to some cancers. But nowadays we have ceramic cookware coming up, right? Instead of Teflon. Yeah, ideally, yes. Avoid heating non-stick cookware too much. Does eating spoiled food without one's knowledge generate cancers? No, spoiled food will give you an infection. You will get a stomach infection, won't cause cancer. Is the excessive use of mobile causing cancer? There is currently no research that shows mobile causes cancer. You can see how much radiation each mobile emits. There is a specific code you have to enter, and it will tell you how many millisieverts of radiation it emits. As long as that has been tested by the company that has made the mobile, you should not technically get cancer. Because not all radiation is the same. It has to be ionizing radiation if it has to cause cancer. Okay, my family has a history of breast cancer, 3 generations, sister expired for the same recently. Possibility for you. You can't numerically give a possibility. There is something known as the BRCA gene. I highly recommend you do genetic testing for the BRCA gene. Right? If the gene is present, then an oncologist will guide you after that. If I do sunbathe up 10:30 to 11, is it harmful? No. In fact, 30 minutes of sunlight exposure every day is recommended for vitamin D, because vitamin D formation requires UV rays. So only when it exceeds that it becomes a problem. Research talking about the heat impact of mobile devices in the front pocket of sperm count. Yeah, so your testicles are outside your body because your testicles require temperature 2 degrees less than body temperature to generate healthy sperm. Now, if you're compromising that through heat, then sperm production will be impacted. Your sperm count will go down, right? That is just a natural fact. the best thing to do is to make sure you have adequate breathing room and breathing space in boxers and things like that. Avoid tight jeans. Yeah, I think that covers all the questions we've had so far. So yeah, thank you all for attending this.